Good afternoon, everyone. It is Friday once again, Dr. Mac. We made it.
We made it. We made it.
Another Friday. I'm sure it's been an incredible week for all of us, especially you.
Yeah, it's been pretty busy. Pretty busy.
And I don't know how we worked it out, but we're coordinating. We coordinate.
There you go. There you go. There you go. That's what I'm talking about.
That's how you do it. I tell you, teamwork makes the dream work, right?
Every day.
Every day. So thank you all for tuning in. We really appreciate you watching us here on the Network Live. I'm April Garner, the network founder, and of course, my partner in crime, Dr. Winston McIver Jr. But I say partner in crime, but it's good trouble, right?
There you go. Good trouble.
Good trouble. Good trouble.
That's the kind of trouble we need.
That's right. That's right. Giving honor to the late great John Lewis. We're getting in some good trouble every Friday. And we've been doing this for a number of weeks. As a matter of fact, we've been doing this for now almost 20 weeks, probably more, who knows? Right. Someone says there's an echo. I don't know. Do you still hear an echo? Can you let us know, Fab Hilton, if you hear an echo? Just want to make sure the audio is good. If not, I will change out my headsets. But we definitely want to thank everyone for watching today, for joining us on the show. And there's still an echo. Yes. Okay. All right. Well, let me change out my headsets real quick. I don't want that to be a problem. Hopefully it's on my end and not on your end, Fab. Hopefully this fixes it.
That's my cousin from Charlotte.
Give us 1 second here. Just have a little technical difficulty, but I do thank you for letting me know. Okay. All right. How everybody good? Okay. I switched out. Is everybody good? I appreciate you. All right. Thank you, Sugar Hill, Rosita Dukes Woodard. She says we good. All right. And also want to welcome today the Emmanuel Nye Memorial Foundation. Thank you all for tuning in. If you are watching from that Facebook page, we certainly do appreciate it. And we usually get into our COVID-19 updates on Fridays with Dr. McIver giving us some stats before we get into some graphs and other things that he wants to share with us. Typically, we have another co-host joining us, Marilyn Hemingway from the Gullah Geechee Chamber of Commerce. However, she is dealing with some critical family issues right now. So we just want to send all of our love and prayers to her and, wishing her family the best at this time. And so at any rate, Dr. Mac, I know that you were busy. He was multitasking, y'all, before we came on air. He was answering calls still. He was trying to get his numbers together, doing a little bit of everything. But that's just because he's so great. And we do appreciate the reputable the solid, consistent information that we get from you every single week. I wouldn't do this if I didn't believe in what you're giving us to each week in terms of reports on COVID-19. So you want to start with your stats before we start getting to all the graphs and charts?
Yes. So again, thank you all for joining us. April and I have kind of come attached at the hip almost with this information and have a usual routine on when we connect as far as talking and planning this. As usual, we typically start off with the numbers, specifically the number of cases worldwide in the last week. For those who are just joining us for the first time, we typically go numbers from week to week, Friday to Friday. In this case, the number of cases worldwide in the last week of COVID-19, the number of cases have gone from 15.8 million to 17.6 million cases worldwide. The number of deaths worldwide in the last week have gone from 639,000 to 680,000. Specifically in the United States, the number of positive cases of COVID-19 have gone from 4.2 million to 4.68 million. And the number of deaths in the United States in the last week has gone from 148,000 deaths to 156,000 deaths. Specifically in South Carolina, the number of cases have gone from 78,000 to 89,000 in the last week. And in South Carolina, the number of deaths have gone from 1,300 to 1,700 in the last week. Horry County the number of cases have gone from 7,200 to 7,900 cases in the last week, and the number of deaths in Horry County have gone from 101 deaths to 129 deaths. Now, Horry County is the third highest in the state in total cases, active cases, and total deaths in South Carolina, only behind Charleston County and Greenville County. Georgetown County, the number of cases have gone from a little over 1,000 to around 1,200 cases in the last week, and the number of deaths in Georgetown County have gone from 13 to 17. Marion County, the number of cases have gone from 436 to 511 cases, and the number of deaths in Marion County stayed the same. Now, I give these numbers with the understanding that these numbers are likely an underestimate of what the true numbers are. Again, we talked about this earlier on in the initial broadcast of this, that there are a number of people that are dying before they're even getting tested. There are a number of people that are dying at home with what was suspected as a heart attack, or suspected as complications from a stroke, when in fact it could have been COVID, and some of it are suspected COVID-19 cases and deaths. So I give all those numbers to say that they're what we have right now. Some of the numbers may not be as accurate because, again, a lot of this data now, particularly the hospitalized data, is now going from the hospitals directly to the Health and Human Services and bypassing the arm of the CDC where it typically has been going. So I do say that with those in mind. Okay, good. April. Now, as far as the other things that we do have a series of slides that I do want to go through just to kind of simplify some things. The first thing is the world map that we have, looking at cases in the world. Of course, the red, the hotter, the more cases that are there. The United States and Brazil, again, those are the two places that the numbers are the highest in cases and in deaths. And again, one of the emphasis there is that, both of the governments in those areas really were underplaying and downplaying the significance, the importance, and the severity of COVID-19 from the inception. Next slide. Next slide kind of shows a bubble of where the numbers are. The larger the bubble, you're over 1 million cases, and it goes down to the smaller bubble, which is like 10,000. As you see, again, the United States and Brazil are basically leading the pack. This data comes from Johns Hopkins and the World Health Organization specifically. Next slide. Next slide talks about new cases reported by day in the world and the new deaths. As you see, the new cases on the left continues to go up. I mean, it's a upward slope incline that's going on in new cases that are there. The slide on the right does show the deaths, and we did at one point in time appear that the number may have been was going down, but as you see now, it is trending up. An interesting thing that I keep telling folks, and I keep getting asked this question, is, why the number of deaths going down? Well, the number of deaths were going down to a degree, but that was just because there were a lot younger people that were getting tested and were testing positive and living. But the way that this condition is spreading is because the number of hospitalization cases are going up. And we'll have a slide on that later on. But this is just to kind of show you across the world what the curves look like. Next slide. Next slide, we're getting specifically to the United States. And as I said, we're over 4.4 million, exactly right around 4.7 million. And the number of deaths actually now, as of today, are 156,000. This slide was by the New York Times, and it was through the New York Times and and Johns Hopkins, and it basically was as of yesterday, but those numbers have gone up today. Next slide. Okay, this is where the cases are rising the fastest. Of course, the darker the color, the faster the rise in cases. And this is actually per capita, so it's per 100,000 people in the past week. and they say per 100,000 to make sure that we're talking apples and apples. And as you see, certainly in the Southeast, those numbers are rising faster. In a lot of places, particularly the Northeast and in the Midwest, where the numbers were up initially, they are having fewer cases. But in the Southeast, we're still, as far as regionally goes, the Southeast is still leading the pack with the fastest number of rising cases. Okay, next. Okay, so what's happening is new reported deaths in the United States again. Back in April and May, a really high number. The numbers started going down, but as you see, the numbers are starting to trend back up again. Partly because the deaths, as I said early, was because when you look at it per person that's getting tested, they were having more young people tested, so the numbers were dropping down in the number of deaths, but the cases kept rising, as I showed you earlier. But you see that graph is going up, and unfortunately, as more people are hospitalized, the likelihood statistically is that the number of deaths will start to go up too, unfortunately. How high, we don't know, only time will tell. But as you see, that graph is going up. This is another graph from Johns Hopkins. Next slide. Okay, just some of the places where the numbers are rising over the last 14 days. As you see, South Carolina going up, Mississippi going up, Florida going up. Louisiana had a good drop off because New Orleans was a hot spot at one time, but they're starting to go up now. Texas, of course, is going up with record numbers. Georgia's going up, Nevada's going up, and Idaho is going up. So again, these are 8 of the states where we are seeing fast growing numbers, where the rates of deaths are increasing significantly. Okay, next. Okay, these are cases and deaths by state. As you see, on the far left is the total number of cases. Of course, Florida, Louisiana, Arizona, Tennessee, but South Carolina is in there. And per 100,000 people, the number of cases is right at 1,700, and the number in the last 7 days per 100,000 is 230. So these are numbers in places where you don't want to be on this list, because this is showing that these people in these states are having major issues in hotspots. And so the concern is that these areas have a lot of work to do as far as trying to lower these numbers. A lot has to go in with reopening schools and things like that to make sure that people that make these decisions understand what these numbers look like and the concerns there. Okay, next. This is a map specifically of South Carolina. The darker the county, the more the hot spots are. Again, a lot of this has to do with per capita. So let's say a place like Horry County, which is bigger than, let's say, Sumter County, it may be more cases, but cases per population is what this is looking at. So you're looking at a lot of places that have, not as many residents there, but per percentage wise, they have a higher number of cases. And that's what this chart actually shows. And this was actually from DHEC. Next, we show the bubbles, and the bubbles kind of just show the number of cases. As you see, Myrtle Beach, Charleston, Columbia, Greenville, and Rock Hill sliding in there, as well as Sumter. So those places, the larger the bubble, the more of an issue that we have in those particular counties in the state of South Carolina. Okay. Again, the numbers here, again, a place like Bamberg, although not as many people as South Carolina, and not as many total cases, but their number per 100,000 is higher because they have fewer people. Horry County is on the list. Again, like I said, is a hot spot, but all these places, all these counties on this list would be considered hot spots, including Florence, Sumter, Clarendon, Horry, Fairfield, Orangeburg, Charleston, Williamsburg, Lee, and Bamberg. Right now, per population wise, Bamberg County, Lee County, Williamsburg are kind of really tipping the scales because they don't have as many citizens in those counties. But again, statistically, they have a lot. Next. new reported cases in South Carolina, new reported deaths in South Carolina. As you see, these numbers are going up. As you see in South Carolina, this graph on the left talks about new reported cases. They're rising. Again, the younger folks have a lot to do with it because, you know, that's where the largest percentage in South Carolina are, between 11 to 30. They make up upwards of 45% of the cases in South Carolina that we're seeing. And the graph on the right talks specifically about the reported deaths. And those numbers are going up. And unfortunately, those numbers will likely go even higher as a number of those people in the hospital have major issues. Now, speaking of hospitalization, these numbers basically are pretty much and that, although this graph says July 22nd, the numbers are still pretty consistent to what it is right now. We're having more people hospitalized now than we did at any point in time during the COVID pandemic. We're still looking at in South Carolina, this is U.S., but in South Carolina specifically, there are 1,400 ICU beds. 1,100 are in use. So we've got an 81% utilization rate of ICU beds in South Carolina. In other words, 81% of beds, ICU beds in South Carolina, are being used for COVID-19. And out of that, over 300 people are on a ventilator. So those numbers are real. That's what it is. South Carolina right now still has about a 21% positivity rate. In other words, 21% of the people that are being tested are testing positive. A great number would be less than 5. A good number would be less than 10. For weeks now, we've been 20+%. So those numbers are much higher than they should be. Okay.
So Dr. Mack, keeping in with the conversation about the hospitalizations and what's going on in terms of capacity in the hospitals, I understand that there was a report that WNBF News ran stating that there were at least 4 local health leaders who wrote letters to the public basically asking everyone to help prevent the spread of the coronavirus, mainly because of this same thing that you're talking about. You know, they're reaching capacities, and you know, there's a need to curb what's going on, to curb the spread as quickly as possible, because we are running into that occupancy issue in the hospitals. And you know, those hospitals included Conway Medical Center, Grand Strand Health, McLeod Lohr, Seacoast, and also Tidelands Health, which really are the, you know, they're the big ones in our local area. Right. And so, you know, from the standpoint of a, you know, someone who owns his own practice, and you're seeing this every day, you know, just kind of break that down for us. When you have health officials basically saying, hey, we need you guys to step up and do what you need to do so that we can, you know, make sure that this thing starts to drop. What does that mean for you as a health practitioner?
It's worrisome. It's concerning. I'm now right at 50 patients of mine that have had COVID-19. Now, up until 2 days ago, none of them had expired, but I did have one that did pass away. And it just so happened to be a family member. So again, this is something that is near and dear. It has hit home. I've had colleagues who've had family members pass away. I've had a mentor of mine from college who passed away, but not anybody specifically in my family. So, you know, again, the hospitals are being slammed, and it's just a problem. The problem is PPE. Mm-hmm. They're getting short on that. The problem is that, you know, you're having physicians that are burning out. You're having physicians that you know, are having to work a lot longer hours dealing with what's going on. And when you see people out, you know, doing stuff, not socially, physically distancing, not wearing masks, it really makes you really, really upset. And because again, it's almost like people just don't get it. I'll tell you this. Washington University has a statistical medical biostatistical program that gives data on the number of projected cases and deaths. And that projection just changed. So now the new estimate is by November 1st, we're on pace to have 230,000 deaths in the United States. That number has gone up 11,000 in the last week.
We're talking close to 250,000 people.
By November. And that's before we get into the real hot and heavy part of cold, flu, and pneumonia season.
Mm-hmm.
Certainly, Herman Cain passing away as being one of my Morehouse brothers, somebody who, when I recruited for Morehouse, he would be on the long list of Morehouse men that achieved a lot. So he was somebody who I had a chance to meet briefly, but who I knew what he had done long before he came on the national scene. He started Godfather's Pizza, very successful businessman. Although I didn't agree with him ideologically as far as politics goes, anytime a man from Morehouse passes away, it affects us, even though a lot of us did not agree with his political ideology. However, when I saw him sitting in the arena in Tulsa, I was very worried for him.
Mm-hmm.
So the fact that he got COVID, unfortunately, the fact that he was in the hospital for close to a month, unfortunately that he passed away, was not really a surprise when you're talking about somebody close to 80 years old, in an environment like that without a mask on. So, we have a Facebook chat, Facebook group for guys from Morehouse. And again, the sentiments were pretty much what I just said.
Mm-hmm.
Was that we were sorry that it happened. We didn't agree with him philosophically, most of us. But again, he was still our brother.
Mm-hmm. And, it's the type of thing when you talk about the relative nature of things, I don't know that people will actually get it until it affects them personally. And even more so immediately, because, there's some people who just feel like they're invincible, that they are untouchable. And if they haven't gotten it by now, they won't get it. But that is certainly not the case. And there's so much that people need to understand, especially as we start to roll back into schools. And, now we have more businesses that are going to be opening, according to what the governor has recently ordered, opening. And with the openings means that there's some relaxation of a lot of the protocols that have been put in place to protect us. And so, there's a solid need for people to make sure that they are following the protocols. And you shouldn't have to wait until someone tells you to follow the protocol. A lot of it is truly common sense. But like you said, when it comes down to the ideologies that some people have, it is, you believe what you believe. But when it comes down to thinking about your fellow man, sometimes you have to use that level of empathy that allows you to have a sense of what they may be going through, and hopefully it will charge you to want to do better, to want to just do it, because it'll make your fellow man feel more comfortable. And we also have a lot of what's going on now with people believing the naysayers versus the people who actually have medical degrees. That just blows my complete mind. I don't know what that's all about. It only takes one person, and I'm not even going to name who we're talking about from this past week, but it only takes one person. And I'm going to put it like this. I had to say this to a colleague of mine. Just because you went to a medical school of sorts does not mean that you are the best doctor and the most reputable doctor in terms of who you should follow, and so you have to do your research of the person and of their beliefs, their ideologies, their practices, things that make sense in terms of your values and your morals, and make sure you're aligning yourself with those things versus just going with what appears to be the next bandwagon hot thing to do. And that's going to get a lot of people killed. I'll say it like that.
And it did in Herman Cain, unfortunately. It's interesting to me, a number of people that come on this show are my Facebook friends. Okay. And so as you know, sometimes I'll go on Facebook rants about this and that. Sometimes I'm quiet for a while, but sometimes I go on rants. But I woke up the other morning just really thinking about how much, that that clip of that doctor just took off like wildfire, and how all of a sudden Dr. Fauci has just become just the pariah in whatever. And so here's the thing that kind of was amazing to me. Okay. And some for you all that are my Facebook friend and you've seen this, please forgive me for what I'm about to do. But out of all the medical books that we use in medical school, if you were to ask your doctor which medical book do they remember the most, they're going to say Harrison's internal medicine book, hands down. Okay, I'm going to show you this, and I want you to tell me what's the first name you see on this book.
Fauci.
Anthony Fauci was the principal author of this book that every medical student knows about. Every medical student had to learn this book. Every medical student had to go through this book. So I'm trying to figure out, this man is this smart. If his book is that important to what we do and how it shaped medical training in the United States, how he actually led the team to try to come up with treatments for HIV and AIDS, how all of a sudden he becomes less than credible in what's going on. Now, somebody said to me the other day, they sent me a message, well, I don't know about this Dr. Fauci because he said do this 4 months ago, and now he's saying wear a mask. All before he was saying not wear a mask, and eventually, and now he's saying it. Well, I said, okay, think about it. The only thing that's constant in medicine is change. Okay, we know now what we didn't know before. Mm-hmm. So again, as we know better, we do better.
We do better. We're supposed to do better.
So for people to kind of use that against him and say, okay, look, well, he's changing what he says. Well, don't we change medical treatments on what we do? I mean, the way that we treat pneumonia now is not the same way that we treated it 30 years ago. Mm-hmm. Medicines have gotten better. Information has gotten better. Technology has gotten better. Science data has gotten better. So again, this is what it is. Mm-hmm. And so I just don't understand how all of a sudden he's kind of become the bad guy. Well, I do understand it, but and the other part about it, and then I won't say much about this hydroxychloroquine because I'm going to leave this alone. I thought that this was already a dead fish out of water, and then it pops back up again. Okay, listen. Those studies, the biggest studies, have shown that it did not benefit. Some of them showed that it actually harmed folks. As a physician who's taking care of a patient who's had some heart issues from hydroxychloroquine, do not take it for COVID-19. It is not indicated for COVID-19. Okay? Now, it is indicated for some things. It is used commonly in African countries and as malaria treatment and prophylaxis is used for that, but it's not indicated for COVID-19. Point blank, period. Now, I'm not saying that it may not at some point in time, but the only thing I wanted that doctor who went up on her passionate plea, her passionate talk, was to show the data. Tell me about the patients that you treated. Tell me their ages. Tell me what other medical problems they had. Were you using this for treatment or were you using it for prevention? More information. Because if you don't have the medical data, you're just giving an opinion. And an opinion is just like an ear. Everybody's got
I'm glad you put it that way.
Right. Exactly. Everybody's got one.
Mm-hmm.
But again, I'm just on this soapbox about these politicians that are talking so much that don't know the difference between a virus and a bacteria. And all of a sudden they wake up one morning and they're now experts on virology.
And I agree with you. And, I was watching some of the Facebook comments and, of course, memes and things that were coming in. And one person actually said something that was, in my mind, a little poignant for the moment. Herman Cain was such a supporter of certain ideologies and, said certain things in terms of wearing masks and all of that, and then fell ill to COVID-19. And, to your point about this hydroxychloroquine, which is a word I can almost not say, if if that was such a level of treatment that we should trust, then, why wasn't he treated with it? Why haven't other people been treated with it? And so I think people.
And you mean with hydroxychloroquine?
Yes. Mm-hmm.
But some of them have and still died.
Okay.
So
That's a good point to make. That's a good point to make.
He may have been taking it and still died.
Mm-hmm.
So again, that gets back to what the physician that was getting up, that was talking, that went viral. If she's talking about all these people that got better, how do we know that they weren't going to get better anyway?
Mm-hmm.
I mean, how do we know that? Mm-hmm. She said she had what, 300. I mean, it took me a long time to get through all of that nonsense. I did watch it from the beginning to end.
It was tiring. It was.
It took me a while to get through it.
Mm-hmm.
But how do we know that all those people that she gave hydroxychloroquine, if she gave it to them, I'll take her at her word. But how do we know that they weren't going to get better anyway?
Mm-hmm. Yeah, this is true.
Because most people do get better.
That's right. And that's one thing, too, that you have made a point of doing is talking about, the recovery right. during this COVID-19 and making sure that everyone understands that, people do get better. There are some people who are extremely fortunate, even if they have been at death's door. But, right. Then there are others that will succumb to it. But, the bottom line is we don't want anyone to be in that situation. And so, just do your part. Right. I have a couple of questions from the graphs that you presented. When we were looking at the chart, which showed that there are more hot spots pretty much in the Southeast and in the South and fewer in the Midwest and Northwest. Why do you think that's the case? Are they not testing as much, or?
Well, I think primarily because those places in the Southeast did not close like they should have. Mm-hmm. I think some of them were following political ideology and not closing like they should have. And I think that was part of the issue. I think the other part of the issue was a lot of the states in the Southeast did not start getting the adequate amount of tests that they needed to get, and still don't have the adequate amount of tests that they need to have. I mean, we are testing more, but we're still not testing as much as we should have, or as much as we should be testing. So I think that's a part of it. I think another part of it is studies have been shown, and I think we talked about this last week, where there's a more lax attitude about COVID-19 just in general in the South. Mm-hmm. I think South Carolina was the worst. Last week it was the worst state in the United States about complying with recommendations given by physicians, the CDC, the World Health Organization. So that plays a huge part in it. Another part of it is poverty. Quite simple. Another part of it is access to healthcare. A lot of these places in the Southeast have what we call medical deserts. In other words, they don't have as many physicians. They don't have as much health care. I think, like we said, in South Carolina, there's 13, 14 counties that don't even have a hospital.
They don't have hospitals, exactly.
So some of these people are having to drive 30, 40 minutes to get health care. So, or to get in, be seen. Mm-hmm. Mm-hmm. So all that plays a part. Additionally, in what we call the Bible Belt, high incidence of smoking, tobacco, heart disease, cancer, strokes, diabetes. It's just rampant in that Southeast area, in our Southeast area. So that plays a part in it. So it's multifactorial. It's not just one thing. Mm-hmm. It's multiple factors involved, but those are just some of them.
Okay. Another question I had are pretty much centers around the reports of COVID cases and deaths in children. There seemed to be a couple of more reports that I saw last week. Have you seen any more information, any more research on what's happening in cases of younger children?
Well, the hottest thing that's happening right now is that there was a study that was done with some kids in the United States and abroad that showed that a far greater percentage of kids actually had COVID in their nostrils than once thought. So in other words, because we're not seeing the number of kids die like we're seeing in adults, but they did see a large number of those kids that did have the virus in their nasal passageways. Now, what does that mean? More study has to be done on that. But again, that is a fact. And that study, that information just came out in the last 72 hours.
Mm-hmm. I see that there are still reports about these cases rising and incidents happening in nursing homes. Dr. Mack, I don't know what to say about it.
I mean, it's a problem. Nursing homes, assisted living, and churches are a problem. Period.
Mm-hmm.
They're a problem. They were a problem from the beginning. And so what happens is that, you know, you have to, in an enclosed facility like a nursing home, you have to have very good quality control, very good infection control, and a very sharp protocol to make sure you're watching for any signs or outbreaks. Mm-hmm. Now, I saw on the news last night, and I get it. Believe me, I'm sensitive to what I'm about to say. There are family members that were upset because the governor did not lift the ban or for people to go into nursing homes like they want to visit their loved ones. Hear me out when I say this. I'm sensitive to that. But if they open up those nursing homes now, people are going to bring COVID into those nursing homes.
Correct.
So if I were the governor, I would not allow people to come into those nursing homes like that. They're going to bring COVID in.
Mm-hmm. Mm-hmm.
You know, those people in the nursing homes, and I went to visit a patient in an assisted living facility last week, and he is scared out of his mind that he's going to die in there. These people that are with it, that you know what's going on, they're worried, mm-hmm. and rightfully so. You know, my relative that passed away was in a nursing home.
Mm-hmm.
One of the ones that was mentioned.
Mm-hmm.
So it's a problem. It is a problem.
Mm-hmm.
It's a hot spot. We talked about the ones in Loris and how they were just a hot spot, but it's you know, throughout the county. Exactly. Nursing homes are prime set up for something like this.
Mm-hmm. All the more reason why we have to be mindful of our practices and, you know, do everything that we can to make sure that we mitigate the spread. Mm-hmm. Just want to remind all of our viewers that if you have any questions or comments for Dr. McIver, yes, he's talking to us and giving us great information, but he's also willing to take questions, and we'll answer these questions to the best of his ability during this broadcast. We certainly do invite you to post any comments or questions. And again, just want to thank thank all of our viewers for tuning in with us again this week. A lot of you are, you know, dedicated. You've been with us from the beginning, and we certainly do appreciate all of your support. It takes a lot for Dr. McIver to bring this information to us every week, especially after just doing what he does on a day-to-day. And we just want to make sure that you all have the best information that you could possibly get from a local source, because there's so much information out there. It's just kind of hard to follow certain things and to believe everything that you see coming at you. So please leave your comments and your questions. And even if we've covered it before, we're definitely willing to go back and answer any questions that you may have. And so, Dr. Mack, I think I'm going to give you a little break before we actually go into a couple of more questions that I have, and maybe there'll be some more questions that will come up. So we're going to just kind of take a look at a nice little trailer about something that the Whittemore Community Magazine is sponsoring this summer. And then we'll come back and continue our conversation about COVID-19.
Okay.
All right.
Ghost Boys is about a young man named Jerome who's playing with a toy gun one winter day, and the policemen suspect that it's a real gun, and they roll up onto the playground and they shoot him, and he bleeds out and dies. But that's just the beginning, because Jerome doesn't disappear. He remains on Earth as a ghost, and he's met by another ghost, Emmett Till, another young black boy who was murdered in America in the 1950s. And Emmett Till, with Jerome, says, "You're here to do something. You're here to bear witness. You're here to help make a difference in the world." And they actually encounter Sarah. And Sarah is the policeman's daughter, the young girl who knows that her father did something terribly wrong, but doesn't know what to do about it. And Jerome and Emmett tell Sarah their stories. And Sarah becomes an activist, a person who becomes part of the change to make the world a better place. She becomes a fighter against racism, against prejudice, against bias. She becomes a fighter for social justice. And Jerome and Emmett, they disappear, wandering the streets until they meet another soul that's open to the idea that they have the power to change, to consider people by the content of their character and not by the color of their skin.
So I want to bring some special attention to the 2020 Summer Enrichment Literacy Initiative that is sponsored by the Whittemore Community Magazine. We have put together a program for our young people ages 13 to 17, something that we think is most appropriate for this time in terms of what we're going through in society, that really encompasses a lot of the themes that Black Americans have had to deal with over the last several months and even over time. And so we've adopted the book Ghost Boys, which is by Jewel Parker Rhodes. I have my personal copy, ordered it from Amazon. It was only $6.81. I'm going to send Amazon an invoice for this endorsement. But anyway, basically, we have put together a program over 4 Saturdays in August that will introduce young people ages 13 to 17 to this book. And we've pretty much developed a program that will challenge them to read the book and then also produce some projects that will give us insight into their views on the central themes that are outlined in the book. So just to give you a little snippet of what you would encounter if you read this novel, basically the author has taken the story, which is all too familiar to us, and it centers around some of the elements in terms of what happened to Tamir Rice, and has created a story wherein a young man and a young woman encounter each other and ghosts who are a part of the community now, ghosts who are trying to instill and incite some empathy in people to understand what their challenges were and what their situations were as they were going through these brutal, violent moments in their lives. And we've put together this particular program because we think that it will be insightful for our young people as they work through understanding some of the things that have been going on since the George Floyd incident, but also as we think about things that have happened in history in terms of civil rights and all of the fights against racial injustice, the honorable work that John Lewis and C.T. Vivian and Martin Luther King Jr. and a lot of others who put their lives on the line over the course of time. You know, those people fought against the same things that are talked about in this particular book. So Jewel Parker Rhodes actually does a brilliant job of introducing these themes from a kid's point of view, basically from a teen's vantage point. And we've put together this program, and I'd like to, just kind of mention some of the people who will be a part of this program. We have Hannah McIver Sands, who is a part of this in a very big way as in terms of introducing this literary curriculum for the program. her mother, Marjorie McIver, of course, is a community icon in Conway, is coordinating the initiative along with Edward and Joella McQueen, who, of course, are the publishers and owners of the Whittemore Community Magazine and also the Whittemore Community Magazine Live broadcast that comes on every Monday at 7 p.m. Marlo Frazier is also a part of this initiative, and yours truly. I will be a part of the initiative as well. And so what we're challenging the participants to do is to, of course, read the book. We have put together a schedule that they can follow to make reading a lot easier for them. They can read it in segments so that they don't have to feel overwhelmed. But I guarantee you, once they start reading this book, they won't be able to put it down. It's actually only about 214 pages. There's some blank pages on the inside where they can make notes and, jot down any thoughts that they have as they read the book. And then they'll go over this particular book in a discussion with us as their reading mentors. So that will all kick off on August the 8th. And we're taking registrations now. This is a virtual reading program. So we will have a Zoom meeting with all of our participants. August 8th is our kickoff at 11 o'clock. And we will talk to them about what the program entails, introduce all of the reading mentors, get to know one another as far as the participants are concerned, and then go over the assignment for the next 4 weeks. On the 15th of August, we will not meet with our participants, but we'll give them that extra week as like a bye week to work on reading the book, but also the projects that they will complete as a part of this particular program. And then, but we will connect with them via phone or video conference just to do a check-in with each of the groups. So each one of us will be responsible for a group of students or a group of teens who are participating. And again, this is for ages 13 to 17. Then on the 22nd, we will have another group meeting whereas we will come back together and we'll talk about our progress. We'll have more discussions about the book and then talk about what they need in order to complete their assignments for the final presentation Saturday, which is August the 29th. And they will present in groups, or if they choose to work individually on their projects, that's perfectly okay. But we'll have a presentation day on August the 29th, and students will present their projects that relate to this book, and then we'll wrap up our discussions about this particular novel. Now, as just a show of appreciation for the time that they're taking to participate, but also, we want to make sure that they are awarded for their hard work and their diligence in, completing this book, and also an extra project at the height of their summer. Students will be presented with a certificate of completion and a monetary award, which will help them to prepare for the new school year. So we're hoping that the monies that we've received, and we have received some donations so far, and I will give you that information so that if you wish to donate, we would love for you to donate, and we will give you acknowledgments, of course, in terms of being a sponsor of this program. But essentially what we want to do is just introduce the students to something that will be literary enrichment. Culturally, it will enrich them as well as we learn more about ourselves. This program is not just for African American teens. I want to say that out loud. Anyone can participate who it falls in that age range of 13 to 17. And if you want to participate, you just simply go to wcmagazine.net. So again, teens ages 13 to 17, parents, sign them up. This is a free program for them. Go to wcmagazine.net. There is a registration form on the contact page of the website. Complete the registration form, and that information will go to Ms. Marjorie McIver, who will compile all of the information for the registrants, and we will send out emails to them with specific information about the project, the program, and everything that they need to know in order to complete the program next month. For donors, if you would like to donate to help us as we pull together our finances for the monetary awards that we're going to give these students at the end of the program, you can actually send checks to the Whittemore Community Magazine, P.O. Box 2391, Conway, South Carolina, 29528. That's the Whittemore Community Magazine, P.O. Box 2391, Conway, South Carolina, 29528. And we will use all donations towards this particular initiative. Now, typically, the Whittemore Community Magazine would host a summer jobs program every summer, but due to COVID-19, we were unable to do that this year. And so this particular literary component actually is our way of keeping the young people engaged in something that's enriching and empowering. It opens up a lot of discussion and creates dialogue that is going to be important to them as they navigate some of these very sensitive issues moving forward. And I think that it would be great to have a diverse group of people engaged in this particular discussion, because we all need to understand one another and need to be able to impart some empathy across lines. And that's the only way that we're going to show our true love for one another and understanding and create peace in our societies. And so sign your teens up as soon as possible. As a matter of fact, the registration deadline is August the 6th. I can tell you that since this is a pilot program, we only have 25 slots. If we get more donations, then we can accommodate more students. But at this time, we only have 25 slots. And I think half or more of them are already gone. So we have about 10 to 12 slots that are left. And all you have to do is complete the registration form on the wcmagazine.net website, and make sure you can give us the all the information that is requested. You will be contacted by one of the organizers of this event, and then we will send you a schedule for the program, which will start on August the 8th. So just wanted to bring that information to you as well. Again, we're reading Ghost Boys by Jewel Parker Rhodes. Get your book, parents. Read it with your children. They can go ahead and start reading now so that they're ready for the discussions, and help us to enrich the lives of our young people. Thank you so much.
Your child deserves the best in life. Grow through learning and positive moments. Caring through love, nurturing, and support. Security in a clean, safe environment. Your child deserves your neighborhood child care and development center. 1100 Quill Street, Conway, South Carolina. ABC certified and USAID approved. Call 843-248-0560 or 843-248-3584 for enrollment information.
Your neighborhood child care and development center is open 6 a.m. to 6 p.m. Monday through Friday, enrolling children ages 6 weeks to 12 years old, serving Conway and all surrounding communities, offering after-school care with a professional, ethnically diverse staff. Your neighborhood child care and development center. Call today. All right, Brother Mac. We're back, and we'll take these last couple of minutes to just kind of recap a little bit of what we talked about at the beginning of the show. Of course, Dr. Mac has given us some great information today. Once again, shared with us the latest statistics locally and, of course, world stats that are highly important for us. And we need to stay educated on this information. Someone said, do your own research. Well, this is a part of your own research. And, trust me, I would not be here in a live platform across social media with this particular physician if I did not believe in his research and the integrity of the data. So we just want to thank everyone for listening today. And Dr. Mac, the only question I have left, or, line of conversation that I want us to go over, the delays in reporting. Have you heard on whether or not there's been any relief in terms of the delays? And we talked about it last week. Some people have taken tests that are now 3 or 4 weeks old.
Yeah. Okay, so let me touch on that for a second. You know, there's over 100 mobile testing clinics statewide. In other words, partnerships between South Carolina DHEC and community partnerships, if you will. We know that there's a backlog in a number of test results that are coming out. That has some to do with this. Okay, that there are more people being tested. There are more information that has to be gathered to get this information out. But in saying that, one thing that I would strongly encourage is any of these people that are organizing community tests to make sure that you have an understanding with the lab that's running these tests that this information needs to come back as soon as possible. I've had 6 patients this week that have gotten tests in a community site over 2 weeks ago and still have not gotten results. Mm-hmm. Now, the reason why that's worrisome, the reason why that's concerning, the reason why that's a problem is twofold. Number one, it is absolutely impossible to do contact tracing if people are getting tested and we don't have results back in a timely manner. If by the time the person's out of their quote unquote isolation 14 days before they get the test results back, then God knows how many people they've come in contact with prior who've come in contact with people, who come in contact with people, who come in contact with people. So if we're going to do these community tests, they have to be back in a timely manner. Mm-hmm. I commend everybody that's doing community tests. I think it's wonderful. I think it's beautiful, but we have to make sure that these tests are back in a timely manner. The labs are held accountable for this. The organizers of these events as well. I mean, but I had 6 patients that I talked to this week that had already been past 14 days that they got the test and had not gotten results back. Like, with Dr. McIver, I don't know what to do now.
Exactly.
I've been quarantining for 2 weeks. And I'm like, well, you know, I guess you've already got your quarantine. I mean, some people that are, you know, getting these tests done are not quarantining. They're still going on about their business and they still have yet to get their results back.
That's right.
That's very concerning, very worrisome that is happening. It's very important to get these results back in a timely manner. It's not just that, you know, we organize a community test. That's only part of the deal. The other part of the deal is ensuring that you're using a lab that is a reputable lab, that is a lab that will get these results back in a timely manner. And I would take it a step further and say any of these community organizations that are organizing this, find out what other community organizations in other places, what their turnaround time has been with these labs.
That's a good point.
And so if organization X in Conway is doing a community test, find out from the testers and from the people, who else did you test? What other churches or organizations did you partner up with? And call those people and find out what their response time has been to getting these results back. And if it's longer, 5 days, longer than 7 days, that is unacceptable. That's unacceptable. Unacceptable.
Absolutely. So I know that we've covered a lot of information, and of course, the stats you give us every week are updates. We're not regurgitating information from the prior week unless we have to, just to make a point. But again, I can't say thank you enough for being dedicated to this platform and for giving everyone the information that they need, of giving me the information I need every single week to make some decisions on how to govern myself accordingly. So thank you again, Dr. Mack. You always put that Baptist finger up. You're like,
I do want to say this question that I'm going to pose is going to be a common dialogue, probably starting in the next 2 months between typical patient and physician. Doc, I need to see you. Patient comes in to see the physician. They talk. The question will go something like this from the patient. Doc, how do I know whether I've got strep, flu, pneumonia, common cold, or COVID-19? Are they going to come in already telling you what they got?
We good for that. Google is our doctor.
That's Google University.
Google University, that's right.
So that's going to be a commonly asked question. That's going to be a common theme as cold, flu, pneumonia season starts to come back on us, really, in a couple months, 6 weeks. So the question is how do you know? Okay. Again, certainly seeing a physician that is experienced in treating these things will go a long way in deciphering what's happening. Certainly doing a good exam on the patient, eyes, ears, nose, throat, chest, listening to, will be a part of it. Certainly there will be more testing being done, whether it's going to be more chest x-rays being done, or whether or not it's this new thing called multiplex testing that will be done. In other words, and this is a term that we will be hearing more about as cold and flu season come, there are these tests that doctors can have, machines that they can have in their office that can test the patient for strep, flu, and COVID. Of course, offices will likely be investing in those kind of tests that these manufacturers are trying to roll out as fast as they can. Certainly we'll be doing them here, as a lot of physicians will be doing it. But that will give some idea to delineate whether it's strep, flu, pneumonia, common cold, or COVID. Common cold will be more of a diagnosis of exclusion, meaning you rule a lot of these other things out and you're kind of left with the common cold. But again, a lot of those symptoms overlap. A lot of them overlap. And so that's why it's going to be so important to look at, for those people particularly who have chronic conditions, particularly over the age of 65, to get pneumonia shots, flu shots, even shingle shots. Now, the flu vaccine. There's a lot of questions, a lot of concerns about when it comes out. Evidently, some of these things are in phase 3 trials, which simply means that there are thousands of people that are being injected, tested to try to see if it's going to be effective. The verdict is still out on that. The data, of course, is still out on that. A lot of this stuff has already been done in lab animals to determine whether antibodies have been produced. There is some issue about what we call rapid decay with antibodies. Antibodies are what the bodies produce to help fight off infections. Some studies have shown that some of these antibodies will go away after weeks to months, when they typically last for year to years. So there's still a lot of antibody information that has to be sorted out. And that's going to be part of the work of trying to come up with vaccines to help with COVID-19. As I said last week, I don't think 2019 or 2020 COVID is just going to go away. That's not going to happen. We'll be talking about COVID in 2022, 2023. It's likely thought that this will be just like you get your flu shot, you have your COVID shot. Just like you get your pneumonia vaccine, you have your COVID vaccine. So that part is really a leading thought right now amongst most researchers, but typically because these antibodies seem to be decaying rapidly, which means you're not immune as long as we thought that most would be immune. So there's a whole lot of information that still has to be determined. We know a lot more about this now than we knew 2 months ago, even a month ago. And there will be more information that comes out. And just because somebody changes what their recommendation is from what they once said before, doesn't mean that they don't know what they're talking about.
Exactly. Does not mean they were wrong. Exactly. And I know that people are kind of hanging on the latest news that's been reported as far as Fauci's comments about a vaccine and the readiness of it. And I think that people also have to be careful about placing words in adding to the dialogue, adding to the narrative. I don't know. I don't believe that the thought or the expression was that it's going to be ready. The expression was more about the fact that, the vaccine is being developed and, what the likelihood is that it will be, ready. I think there's some things that are being tested now. And, people just need to be patient and be careful about their sources. Just make sure that you are, double checking, fact checking, just like everyone fact checks, even Facebook fact checks you now. Fact check your information before you develop your opinion on anything.
Yes, definitely. And again, we just, the hope was that we would at least be out of the first phase by now. The thought was 3 months ago, particularly 2 months ago, when New York was really getting hit hard. Chicago was getting hit hard. Detroit was getting hit hard. New Orleans was getting hit hard. And we certainly knew that the southeastern states were eventually going to get affected. I mean, we knew that, but just not necessarily to this degree. And it really, we're really about to we're really about to get to the end of the summer, and we still haven't gotten out of phase one.
That's right.
So it's affected stuff from, tens of millions of people being unemployed, no insurance, to people dying, to just reopening schools, to how it affects athletics. And it's really, really a major issue. There's a question on here about if you have recovered from, this is from my cousin in California. If you have recovered from COVID, do you have to worry about exposure? Well, it appears that you do, because again, if you have COVID, the thought is that you should produce antibodies, Kelvin. But some of these studies have shown that some of these people's antibodies have decayed and gone away very fast, which would make them vulnerable potentially to getting COVID again. So again, even those people that have had COVID still need to practice social and physical distancing, strict hand washing, wearing masks when in close proximity to others.
Dr. Mack, if I'm going to talk about workplace. If a person suspects that they have been exposed to COVID-19, they know for a fact that they've been around persons who are positive. And do they have to be concerned with the length of time they've been around the person, or is it just exposure in general is what you need to be concerned about?
I'm sorry, go ahead.
I'm sorry. Okay. So that's the first question, is there like a time limit that you have to be concerned about? The second part is, once that person realizes that they've been exposed to COVID and they've possibly been back in the workplace or what have you, is it necessary for then everyone that they have been in direct contact with to be tested because that person has been exposed, or is there like an incubation period or something that, one needs to be concerned about before you can safely say that you are or you will not be, exposed or affected?
Okay. Good. Very good question. There's a time and a distance variable that's put on this. In other words, if you're around somebody for longer than 10 minutes and you're less than 6 feet and they're positive, you should get tested.
Wow. Then, and I don't know that we've ever really put it out there quite like that.
Right. I mean, that's relatively new stuff, and the amount of time, the proximity, all that's kind of been debatable. It's been talked about in medicine. I never brought it up here because it was kind of all over the place.
It was all over the place. Yeah.
But it's kind of thought 10, 15 minutes.
Is all it takes, basically.
10, 15 minutes, less than 6 feet proximity
6 feet.
with the person that's positive. So if you know you got a workplace cubicle and it's pretty close, and you've been around that person, and you then hear that person is positive, you should get tested.
Okay.
You should get tested.
Yeah, I think that the time and proximity issue, hopefully that'll drive home the point of the precautionary things that we need to do as well.
And time and proximity has always been kind of a part of viruses, virology, contact tracing, because again, you have to determine who you've been around, how long you were around them, and how close you actually were to them. Those are very important, particularly with viruses that can be respiratory. Right.
How does a mask play into those dynamics? If let's say the person who's been exposed was possibly wearing a mask in the workplace, does that negate it?
It depends on what kind of mask it is. It depends on, still, if the person's positive and they still been wearing a mask, you still need to get tested.
Need to be tested, exactly.
Okay. There's another question about should you be showing symptoms or should you just get tested? Okay, so here's what happens. You don't always. A lot of these people now are not having symptoms. So this thing about checking temperatures and temperatures being elevated, I'm not saying don't check it, but there are going to be a number of people that have it that don't have a temperature.
Right.
Okay. So there are going to be some people who, won't have any symptoms at all. They're the asymptomatic person. And we saw that being more of an issue in the younger folks as they tested. They were lying about not having symptoms, or they just weren't having symptoms at all. But regardless, there's data that's out where it's a large number of people in that 11 to 30 years age range which have no symptoms. Now, part of that is because most of those people are healthy. Most of those people don't really have any medical issues. Most of these people have intact, healthy immune systems, intact immune systems, so they can stand to take a hit, so to speak, and their immune system responds in a positive, appropriate manner. But if you've got a person over 65, a person with multiple medical problems, a cancer patient, previously had cancer, diabetes, hypertension, sleep apnea, obesity, those people's immune systems are not as strong. They're not as intact as somebody who doesn't have those issues. Hence, that makes them more susceptible to bad outcomes.
Well, I tell you, it's we've learned a lot today, and there's more to come, especially as we move closer to the school reopenings. I'm sure that, a lot of people will have questions about what to do as they make their decisions. And we certainly welcome any questions and comments to that effect. We've, had our Horry County school representatives on, and we're working on having more people on after they finalize their plans. August 3rd seems to be the pinpoint date. I understand that there was an email sent out today to parents, basically saying if you're interested in virtual learning for the school year, you need to go ahead and register, enroll your student. So that might be some indication as to what's to come in terms of the decisions that we'll hear on August the 3rd, which is what, Monday? Is that Monday? Well, we won't hear it on Monday, but I think after Monday we'll know something. Who knows?
It's going to be hard to have these kids go back to school.
It really is.
I mean, I just, it's going to be hard. It's going to be hard. I mean, how are you going to get these kids on a school bus? I mean, how does that happen? How are these kids going to get on a school bus? How are you going to get these kids into school? How are they going to go to the bathrooms?
How are they going to eat? I mean, cafeterias are large, yes, but we're talking social distancing in these cafeterias.
The numbers are worse now than they were in March.
Mm-hmm.
The hospitalization rate is worse now than it was. Believe me, I want my kids to go to school.
Mm-hmm.
I think most people want their kids to go to school. But it's going to be tough. How are these kids going to play sports?
Mm-hmm.
I mean, it's going to be tough. And so, I just don't know. I don't know.
Mm-hmm.
I don't know. I think by giving an option of online school, I think that will cut down on some of the traffic in and out of the schools. But it's going to be tough for that to happen. So I don't know. I don't know. I don't know. Everything I see says that we're in worse shape now than we were in March.
Mm-hmm.
I don't see anything that says we're in better shape.
Mm-hmm.
We've got a 21 to 22% positivity rate. That means 1 out of 5 people, almost 1 out of 4 people that are testing positive. And it's thought for every 1 person that's positive, probably 8 to 12 more are positive and don't know it.
Mm-hmm.
So, I'm concerned. Yeah, and there's another question about an overnight camp in Georgia that had this COVID outbreak. Yeah, I mean, again, it's hard to keep these kids separate from one another.
Mm-hmm.
It's hard to keep them separated. And so it's one of those things where if there are not protocols in place on distancing, sanitation, drinking after one another, if they don't have these kind of protocols in place, it's going to be tough. What's going to happen when the kid goes to the water fountain and the kid afterwards goes to the water fountain?
And that kind of activity is it's almost impossible to patrol, because you can't possibly have, people just acting as hall monitors all day, watching every, 5 students or whatever to make sure that they're wearing their mask properly. They're doing this, they're doing that. There's no way possible. And so logistically, it's a mystery right now. And, hopefully the school districts are figuring it out. It's a very tough job, very, very difficult task, I'm sure. But if the school districts can't figure it out, then the parents have to figure it out for them and make the right decision for their children.
Yeah.
That's just the bottom line. So, well, Dr. Mack, is there anything else other than, what we've pontificated here today?
Well, as always, I try to end on a positive note. Again, what I give is facts, not fear. Again, what I say is what it is. Every source that I use is a reliable source with reproducible information. Every stat that I give is likewise. If ever it's my opinion, I will preface it by saying, in my opinion. Positivity to end on. Worldwide, there have been over 11 million people that have recovered. United States, over 2.3 million people that have recovered. In South Carolina, over 32,000 people that have recovered. So when we do the right things, when we do them the right way, we'll have good outcomes.
Mm-hmm.
I mean, it's not difficult. It's not anything that's earth-shattering information. People are getting better. 11 million worldwide, 2.3 million in the US, over 32,000 in South Carolina have recovered. But please, please take this seriously. Again, as I mentioned about my Morehouse brother, former presidential candidate Herman Cain, you have to take this seriously. And the first thing that went through my mind when I saw him in that crowd was, oh my God.
I think a lot of us felt the same way. Mm-hmm.
And when I saw the day before in the newspaper that he was still in the hospital, I said, he's not going to make it out. Because now you're talking about almost a month in an ICU on a ventilator in a person that's, almost 80 years old. That's tough. Statistically, that's tough. Now, I have had a patient that was older than that was on a ventilator for about that amount of time, and actually was on dialysis too during the hospitalization, and he made it out, and he's still alive now. So can it happen? Yes, it can. But statistically, he was going to have a hard time making, even after being on a ventilator for a week, being that age. I don't know what all his medical problems were.
So possible, but not probable.
Right. And so each day that went by, each week that went by, that person's sick to that degree makes it, more probable that person's not going to have a good outcome.
Exactly.
Again, to the community testing, please check to make sure that whoever the lab is, the resource lab that you're using, get references from people that use that lab before to see what turnaround time is. Again, patients are being tested 2 weeks later, almost 3 weeks later. In some cases, patients have told me when I talked to them this week that they still haven't gotten their results.
That's right.
So again, when it takes that amount of time, it's hard to contact trace. It's hard to tell people what to do. It's hard to do that when you can't. And contact tracing does save lives. Again, I was part of contact tracing when I was in college and intern at the CDC. Back then it was HIV and AIDS, and that was important. That was crucial. It's just as crucial now for COVID-19 as it was in the 80s for HIV and AIDS.
There's a question before we leave, and I I'm big on trying to answer everybody's question if we can catch them. Angela Robinson, she says that teachers have to report to school every day to teach, regardless of hybrid, virtual or face-to-face. Is a mask enough to protect teachers from one another?
I mean, the mask is the minimum. Certainly, we talked about distance. We talked about time. You'd wanna just protect yourself. I mean, those are the main things. I mean, when the kids get back, will a mask be enough? I don't know. But certainly, a mask is a minimum. It's a minimum.
All right. Well, if you have any other comments or questions, of course, we're able to see the thread even after the broadcast is over. The broadcast will also be available on all of our Facebook pages, the Emmanuel 9 Memorial Foundation. Thank you so much for being a part of this broadcast and for future broadcasts as well. And also it's shared from my personal page on Facebook, which a lot of you are probably on my friend list, but also to a couple of other groups, including the Whittemore Community Magazine's page. And then we will also upload it to YouTube as well. And you can watch the broadcast if you've missed this significant information. So again, Dr. Mack, thank you so much. And we hope that everyone has a safe weekend. I know that we have a tropical storm. Is it Isaiah? Is that the name of the storm? Or is it?
Sure.
No, I don't think it's Isaiah. I can't remember the name right now. But we have something that's brewing out there. And someone said, I hope it washes Rona away. I'm sure we all wish it would.
That would be nice, wouldn't it?
That would be nice. Look, but not probable. So,
right. Possible, but not possible.
Exactly, not gonna happen. But anyway, but thank you all so much for joining us, and we'll be back next Friday if God says so, and the creek don't rise. We'll be back with more information. Right. And again, thank you so much for your support, y'all. We really do appreciate it.
Yes, thank you.
All right, thank you so much.
All right,
God bless.
You all. Bye-bye.